First, let's welcome Dr. Kelly Erola, a nurse practitioner and Weatherford of Lower Cape Fear Hospice and LifeCare Center. Well, welcome. Thank you both so much for being on the show today. We're glad to have you here. I think we'll start out, just by learning a little bit about both of you. So, Dr. Erola, do you want to tell us just a little bit about your background and your role, maybe where you're from?
I'm the Chief Medical Officer for Lower Cape Fear Hospice, which has a hospice program as well as a palliative care program. So I'm also in charge of the palliative care program. I'm fairly new to the area. I'm not new to the field of palliative medicine. I've been doing this full-time for 16 years, but I'm new to this area over the past year, and I'm very pleased to be here. I'm originally from Canada, so enjoyed the winter weather last week. No, I didn't. But I'm really pleased to be here and really proud of our palliative care program, which we'll talk a little more about.
Yeah, well, welcome. We're glad to have you here. And Ann, you want to tell us a little bit about yourself as well?
Well, again, I've been in Brunswick County again for 8 years. I live down in Southport. I have a little boy that goes to Southport Elementary. I did, as a nurse, as a floor nurse, we did a lot of palliative care in the hospital that I came from, MUSC. Then as a nurse practitioner, I worked a couple years in geriatrics and transitioned that into the hospice and palliative care. It's always kind of, I guess, been a calling for me. So, and I've been with Lower Cape Fear for 5.5 years.
So you started sort of with the senior population.
I did.
And kind of moved into
It was a niche that was a good fit. I actually started in pediatrics.
Wow.
But that was brief and really found my niche doing geriatrics, nursing facilities. I love that patient population.
Nice. Well, I can tell just hearing you speak about it that it's a passion of yours that comes across.
They all have such stories. I love just connecting and hearing stories and
Well, it's probably important, first of all, and I know I struggle as well a little bit, even being around healthcare, and what exactly is palliative care? So maybe, Dr. Erola, can you give us just a description of what palliative care means, what we're even talking about here?
Palliative care is a form of specialized medical care for people with serious illness. It's a team approach, nurse practitioner, physician, social worker, other members as we need it, to help provide support to the patient and the family. So it's an extra layer of support. And we say serious disease, we mean heart disease, COPD, lung disease, dementia, cancer. So those are all serious diseases that can present with symptoms, pain, anxiety, stress. We also have discussions on goals of care, understanding what's going on with your disease. What do you think, what's happening, what's going to happen? And we also try and coordinate care with the other providers, because as we know, in healthcare, it can be very fragmented. The patient might see a lung doctor for something and a heart doctor for something and their cancer doctor for something, but who actually sort of puts it all together into one? So often in palliative care, that's what we're providing, that extra support for the patient and the family.
That's wonderful, bringing it all together, it sounds like, and that added layer. So I know, when we hear, and Lower Cape Fear Hospice and LifeCare Center is so well known in this area. You're both with that organization. When we hear that, we think hospice.
Right.
So the difference between hospice and palliative care.
Right, and that's whenever you hear the word hospice, unfortunately, people immediately think, oh, I'm going to die, which isn't necessarily true. But palliative care is a care for patients with serious illness who don't necessarily have a prognosis of 6 months. To qualify for hospice, you have to have a prognosis of less than 6 months if the disease runs its normal course. Okay. In palliative care, it is not associated with any prognosis. It's basically you have a serious disease that you need help with. You may be undergoing treatment, so you may be having very aggressive care and need palliative care to help manage symptoms.
Support all of that.
So there's no prognosis associated with. It's that extra support. It can happen early on in disease, it can happen mid-disease, late disease. So we really try and help people to understand. I say to a person, you know, if your physician wanted you to see a cardiologist because you're having heart issues, great. If your physician said you need some extra help to manage pain and symptoms with your illness, you need palliative care, people should say great.
Right,
because it's this extra support that's there.
Yep, just something else to help. That sounds great. But you're right, I think there's almost a stigma when you hear the hospice. And it sounds like this is such a different aspect and such a supportive system. So, and I know a new arrangement, right? I mean, this is a kind of an advancement in care at Novant Health Brunswick Medical Center. I know we've had a relationship previously, but tell us about what's new and what your role is with palliative care at Novant Health Brunswick Medical Center specifically.
Yeah, so, you know, we talked a little bit earlier about the fact that, you know, I service people in the community a lot. So we've been doing this rather, you know, rapidly growing palliative care for the last year and a half, really focusing in on that. And then we entered in this partnership with Novant. So I would get a referral here and a referral there, and I'd stop by. I'd go see a patient here and there. And so as the last year and a half has progressed, I think the need has just shown itself. And so they've entered into a formal partnership. So now that's my job, is to go to Novant and help with some of these difficult conversations with these folks with chronic disease that are having frequent readmissions, and just talking about, you know, the goals. What are their goals? What do they understand about where they are? Oftentimes when I get a consult and you walk in the room, there's that deer in the headlights, like, oh, palliative care. And I'm like, I am not hospice. I'm here to, you know, just, you know, and I often let the patients lead that conversation.
Right. So. What is it they need? And yeah, that makes sense. So you kind of referenced kind of a typical day. I think it's probably interesting for people, like how you mentioned a consult. How do you get a consult? Is it the hospitalist at the hospital who notices with the patient, or is it maybe the doctor outside the hospital? How does that?
So, you know, obviously, we're a consultative service, so we want to have the blessing of the physician managing the care. So the consults come from the attending physicians at the hospital. Sometimes we continue to follow our patients, outpatients, then we get, you know, then we notify their primary care physician and get their blessing as well. Because without their support, then we're not of good benefit. If we're not all having the same message, then we're not of benefit. So so the hospitalists give me the consults. Sometimes, you know, it can be a team approach where case management or speech therapy may say, hey, we may need to get palliative care in with this family to start some discussions. So it often is team, but it's definitely driven by the hospitalist team.
Right.
And we're really pleased that really benefits the hospital in terms of helping with management of the patients, and it also helps the physicians. And as we still have education to do, not only with the public on what palliative care is, but also with the medical community, because there's still confusion with them that if you mention palliative care, my patient doesn't need hospice. That's not what we're talking about. So we still have to educate. But I think at Novant, the physicians are very supportive. They've really wanted palliative care. They really want this service because they see it such a benefit for their patients and families. So that's really exciting. So they're willing to send the consults and say, "Come on, Ann, we need you. Come on, come and see this. Come and see this patient or this
we
family."
We always picture a sports analogy, but everybody kind of running to help the person in need, you know, with whatever services they need.
And we also, you know, want to continue when a patient is admitted into hospital and they receive inpatient palliative care, they may have needs that they have when they leave. So when they have to leave the hospital, we also work on trying to arrange some follow-up outpatient for them as well.
Nice. You kind of mentioned that as well. So there's actually kind of a similar to your position, Ann, right? That would see patients in people's homes afterward. Is that how that would work?
Yeah, exactly. And that, you know, kind of to, you know, go back to what you were asking, what a day is like for me. It used to be I would balance between going into people's homes and the hospital. And so, now there's a nurse practitioner who is dedicated just to people in their homes, and we've got a really good team member for that, and we're excited about that. So, so this lets me focus on the hospital, and they will now have better support at home, I think.
Well, it's great to see services like this expanding in Brunswick County. Just more and more services come into local residents and more availability, so it's a great thing. Is there anything else you would add about kind of the specific benefit to the community? I know we talked about just that added layer of care. Is there anything additional that you want to make sure we mention or talk about?
I think this partnership is wonderful, and I think it's very innovative. There are still areas, palliative care is taking off all over the country, but there's still pockets where there isn't. So it's really exciting for Brunswick County that you have a health system partnering with a community organization, Lower Cape Fear Hospice, so that we can provide the best services, the best state-of-the-art services we can for the community. So I'm really excited about this partnership and being able to better serve Brunswick County.
Very good. Thank you. Thank you. Now, is there anything, if someone at home has a question about palliative care services, about any of this, and is there a way that they can reach out to Lower Cape Fear Hospice to learn more and ask any additional questions?
Yes, there is a 1-800 number that they can call, and all they have to do is to call. There's a question we get is, how do you get palliative care? Well, as Ann said, we'd like your physician to order it. However, some physicians don't know, so I always empower people, ask your doctor at palliative care. If they don't know what palliative care is, they need to learn. But anybody is free to call our referral line, our number, and we assist with getting the proper resources, the order for palliative care, discussing the program with them. So it makes it very simple.
Sounds good. Sounds good. Well, thank you both so much for being here today. I think this is a really important message that you've shared with the community, so thank you.
You're welcome.
Thank you.
Pleasure.